The topic of my talk is parenthood. Now, parents are the most important, parenthood is one of the most important roles in adulthood. Kids are the love of our lives, but for sure can drive us crazy at times, and not very rarely, I should say. Now, emotions are a significant part of the parent-child relations. So the aim of the study is to link two major disciplines. The first discipline is that of basic psychology and the study of emotions, and more specifically emotion regulation. And the second discipline is that of social welfare and the study of parenting and what is effective parenting and how can we help parents be more effective and parenting skills. So what is emotion regulation? I'm referring here to the work of James Gross, who is also a co-author in this study. Emotion regulation is the way that individuals influence which emotions they have, when they have them, and how they experience and express them. So what do we do when we are feeling anxious or stressed? What do we do when we're sad or depressed or we're furiously angry? Do we lash out? Do we go to sleep? Do we exercise? Do we cry? Do we talk with somebody? So this is the study of emotion regulation. How do we control our expression of emotions? Now, emotion regulation is a temporal process. It starts with an emotional cue that gets generates the emotion, and then begins the process of emotion regulation. It starts with situation selection and situation modification. If, for instance, I'm a parent who needs to go to see a doctor, and I know that every time I take my child who is 3 years old to the doctor, I get frantic because of all the medical equipment there, and I get stressed with all the needles and stuff, I may select not to do that and not to take my 3-year-old to a clinic, but or to modify the situation by getting snacks, getting him toys, or things like that. I can also use attention deployment. Now I want to show a short video.
Lewis, Mom, Mommy, Mama, Ma, Mom, Mommy, Mama.
What?
Hi.
So this was not that effective, but we can see that we are all starting to be a bit agitated by this video, which is, by the way, less than 1 minute, although it seems, I think, longer. So the next step in the emotion regulation process is cognitive change. For instance, this mother could, when she's thinking about what just happened with her and her son, think about, well, I have a persistent son. I mean, will be good for his future. When he wants something, he just won't let go. And the last stage of emotion regulation is response modulation. We can see that in anger management. And some people, when they feel that the emotions are too much for them, they exercise, they meditate, they watch videos of cats. They do things that they know that will relax them. So this is the emotion regulation process. And in parenthood, emotion regulation is critical. The emotions in parenthood are many times overwhelming. Parents can be the most dysregulated people in the world. We can see that. With anger, we can see that in sadness and depression. So why is it that there is almost no studies that link parenting and emotion regulation? So in this case, I would like to look at the continuum of parenting between benevolent parenting and child maltreatment at the other end. When in child maltreatment, I mean child abuse and child neglect. And I will examine the risk factors for child maltreatment to show the emotion regulation theory of parenting. So emotion regulation model of child maltreatment looks at multiple risk factors that have been described for child maltreatment. The child maltreatment literature is very vast, and there are many risk factors that have been described as risk factors for child maltreatment. And what we would like to show in this project is that emotion dysregulation is the leading force to many of the risk factors of child maltreatment. So many of the risk factors that are attributed to child maltreatment could stem from emotion dysregulation of parents. And for that, I would like to show 4 small vignettes with the kind help of my daughter, Daphne. So we will be showing 4 families. And each family will have a different hat that I will wear. That has been selected, yes. So first, depression.
Mom, you could help me with homework.
Not now, sweetie. Not now. Not now, honey. No, call Grandma, okay?
Mom.
No, I'm sorry. No, I can't. Tomorrow.
Mom.
Call Grandma.
Mom.
Call your dad. Call somebody else. Hyperactivity and anger management. What? God damn it, Daphne, what again? What? 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 Stress management. What? I can't hear you, sweetie. What? What? What?
Mom, we need to bring a dog, a cat, and 3 cakes. A dog and a cat and 3 cakes to school.
What? Tomorrow? I can't do that. I have work. What? What is up with your teacher? No, no way. No, sorry. And parenting skills. Daphne, go clean your room, sweetie. Go clean your room. 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 Not very effective. Thank you very much. By we're not done, sweetie. One more sentence. Come on, come on. By showing the emotion dysregulation component of parenting, we can show that maybe we can help families better. Thank you, sweetie. Thank you. So the importance of this study is, first of all, practical. We are talking about the well-being of children, and parenting, as you all know, is very important for the well-being of children, not only at the phase of childhood, but also as adults. And I would like to very briefly state 4 projects that I'm a part of that have to do with these topics. I'm part of the research program at UCSF headed by Professor Lieberman, and this study examines the child-parent psychotherapy, a treatment that was developed by Lieberman and Van Horn in a group of traumatized pregnant women. So this is a primary intervention program that administers this therapy to pregnant traumatized women in an attempt to reduce the likelihood of maltreatment in the child that will be born. So we can see that there is a significant decrease in depression following treatment. We have high levels of depression pre-treatment and lower levels of depression post-treatment. We see the same pattern when we're looking at post-trauma, high levels of pre-treatment post-trauma and lower levels of post-trauma post-treatment. And we have elevation of positive child-rearing attitudes from pre-treatment to post-treatment, which exactly refer to the ability of the parent to nurture, specifically here, the mother to nurture her child after he was born, he or she. The second project in the same research program is comparing single generation to multi-generation foster care women. So women with, that are multi-generation foster care, meaning that they themselves were foster children and have children in foster care. And we compare them to single generation foster care women and try to predict what helped these women to be in a single generation foster care. The third project is working with Dr. Romney from the Parent Training Institute in San Francisco that examines the effectiveness of the Triple P parenting program. This is a program that was originated from Australia, and it's an evidence-based program that has been disseminated in San Francisco. And we will be looking at the effectiveness of this program as dependent on personal and organizational factors. And lastly, I'm working with Professor Katz, who is here, on examining the construct of parental emotion coaching, which has 3 steps that are highly relevant to emotion regulation: the awareness of the parent of his or her own emotions, and regulation of his or her own emotions, and then coaching the children on emotion recognition and emotion control and regulation. So she has a nice project of examining the emotion coaching abilities of women who are survivors of domestic violence. The second importance of the study is theoretical. Emotion regulation in parenting would enable us to link these 2 basic disciplines of psychological study and social welfare. It will generate a theory of parenting that explains the etiology of risk factors and would enable us to have predictions for further study that will examine this theoretical model.